Hey, good day, class. Welcome once again to this lecture series. The last time we had a class, we talked about the lumbosacral plexus, the series of nerves that supply the lower limb, and if you remember vividly, I told you that we were supposed to talk about the compartments of the thigh. Since we spoke about the femur as a bone, we needed to talk about muscular attachment and structural attachments to this femur. So in today's class, that's what we are going to be doing today. Today we are going to, facing us here is the anterior compartment of the thigh. So we are going to be talking about the anterior compartment of the thigh today, and one of the first muscle that we are going to be talking about today is the pectineus muscle. The pectineus muscle, the one in green color. Yes, that's green. Okay, it's a flat and quadrangular muscle that is placed superior medially, as you can see in the image here. It's placed superior medially. Okay, it's actually a transitional muscle between the anterior and medial compartment. That's why you can see me trying to look at it from the medial side of the thigh. So it's a transitional muscle. Some people call it a medial, a muscle of the medial compartment, while some call it, but it's the truth is it does the action of a medial rotator of the thigh. So it's a flat and quadrangular muscle that has a superficial and a deep layer. Actually, it attaches superiorly, as you can see from the image there. It attaches superiorly. It attaches superiorly to proximally to the superior ramus of pubis and distally to the pectineal line of the femur, just a little below the lesser trochanter, and although it might actually it might receive a branch from the obturator nerve. Remember the obturator nerve, it might receive a branch from it. It might, but its main supply is from the femoral nerve. Okay, it's from the femoral nerve. And what does the pectineus muscle do? Well, the truth is, even though it is a medial, it assists in medial rotation of the thigh. The main function is to adduct and flex the thigh, which is what the adductor muscles do. Okay, so even though it's medially rotate, assists in medial rotation of the thigh, the main job that it does is to flex the thigh. Another muscle that we are going to be talking about is the Sartorius muscle. Okay, the Sartorius muscle is it's a very important muscle. Okay, if you remember, we've given it a nickname. That's the tailor muscle. Okay, the tailor muscle. So the Sartorius muscle is this muscle in green right now. As you can see, it is actually the longest muscle in the body. Understandably so, the longest muscle in the body. And I have given it my own nickname. Okay, apart from the tailor muscle, I also call it the cross-leg muscle, or the cross-leg and dependent muscle. The cross-leg and dependent muscle. Well, I'll tell you. I'll of course I'll tell you. Actually, it is the longest muscle in the body, and it's ribbon-like and obliquely placed. As you can see, it is actually obliquely placed superficially from the lateral to the medial across the thigh. From the lateral side, from the tip there across the thigh, it's proximally there. It is actually coming from the anterior superior iliac spine. The anterior superior, and distally it goes to the superior part of the medial surface of the thigh. The medial surface of the thigh. As you can see where the green muscle ends at the superior part of the medial surface of the thigh. Actually, it is innervated by the femoral nerve. If you remember, the femoral nerve is the muscle of the anterior compartment of the thigh. Okay, so the muscle that I just mentioned the other time, which is the pectineus muscle, even though it gets its origin from the obturator nerve, which is a nerve for the adductor muscle, it is supplied by the femoral nerve. So this Sartorius muscle, it's actually supplied by the femoral nerve, and it functions to because it goes across two joints. It passes through. It crosses the hip joint and also the knee joint. It make this ensure that it does more work than most of the muscles. For example, it flexes, abducts, abducts and laterally rotates the thigh at the hip joint. It also flexes the leg at the knee joint. Okay, so because it is a two joint muscle, it flexes, abducts and laterally rotates the hip joint, the thigh at the hip joint, then it also flexes the leg at the knee joint. Actually, it is a weak abductor, ABD of the thigh. Okay, even though it's a weak abductor of the thigh, and in fact, none of its action is actually strong. None of the, even though it is it's the longest muscle and stuff like that. That's why you now see where my nickname is coming from. A dependent muscle is a dependent muscle. Even though it does all this function, none of its action is strong. Instead, it relies on other muscles. So we can say it is mainly a synergist muscle. Okay, so our two Sartorius muscle makes it possible. That's another function now. You know, we have two on either leg. Okay, so one on each leg. Okay, on each thigh. So the two Sartorius muscles that we have makes it possible for us to cross our leg whenever we are sitting. When we are in a sitting position. Okay, so that's why I called it, if you remember, it's called the tailor muscle because it's ribbon-like. Okay, and it's the longest muscle in the body. Okay, then I called it the cross-leg muscle. You now know why I call it the cross-leg muscle, because it enables us to cross our leg in sitting position. And I also call it a dependent muscle because it relies on other muscles to perform its function. Then there's another muscle. We have another muscle called the quadriceps femoris. The quadriceps femoris is quadriceps from the name, four muscle. Quadriceps femoris, four muscle. Okay. Let's move away from this place. That's the rectus femoris. Now, before we be able to view the quadriceps femoris, okay, before I talk about the quadriceps femoris, let me talk about the rectus femoris, because that will help us so that we'll be able to go from superficial to deep. Okay, the rectus femoris, as you can see in this image here, the rectus femoris is part of the muscles called the quadriceps femoris. Okay, the quadriceps femoris actually is four-headed. It has four heads. Okay, we have one, the rectus femoris, which is in green right now. We have the vastus lateralis, which is here. We have the vastus medialis. Then when we remove this muscle here, we are going to come across the vastus intermedius. Okay, so before we remove this muscle, let's talk about the rectus femoris first. The rectus femoris is actually a Greek word a Latin word for straight. Okay, it actually proximally attached to the anterior inferior iliac spine. Okay, and the ilium superior to the acetabulum. Okay, so that's the rectus femoris. Okay, now when we talked about the vastus medialis, okay, the vastus medialis is found on the medial side, as you can see, of the thigh. That one proximally attached to the intertrochanteric line and the medial lip of linea aspera of the femur. Then we have the vastus lateralis here. The vastus lateralis is found on the the vastus medialis is found on the medial side, while the vastus lateralis is found on the lateral side of the thigh. It's proximally attached to the greater trochanter, okay, superiorly, that's proximally, and and the lateral lip of linear aspera of the femur distally. Then when we remove this muscle here, we are going to remove this muscle here, okay, so that we will be able to see the vastus intermedius. That's the vastus intermedius. The vastus intermedius is deep to the rectus femoris. As you can see, when we remove the rectus femoris, we're able to see the vastus intermedius. Okay, it's deep to the rectus femoris, and it is between the vastus medialis and the vastus laterali. Proximally, it attaches to the anterior and the lateral surface of the shaft of femur. Okay, to the anterior and lateral surface of the shaft of the femur, and it actually gives birth to a very small flat muscle called the articularis genius. Okay. Okay, let's not talk about the articularis genius right now, because the picture, this image is not depicting that. So this four-headed muscle, I'm talking about the quadriceps femoris, is actually attached distally through a common quadriceps tendon. Okay, they come together as one quadriceps tendon that will now attach to the base of the patella. As you can see, all here, all this muscle here, all this muscle here. Sorry, not this. That is actually the tensor fascial lata. Okay, so this muscle here, this one, and the one I moved away. Okay, that's the rectus femoris. Okay, all has a common attachment. Okay, they all have a common attachment. They all have a common attachment to the base of the patella. Okay, talking about their innervation, well, they are all muscles of the anterior compartment, so it's fair to say that they are all innervated by the femoral nerve. Now, what do they do as a group of muscles? Well, it is actually the greatest extensor of the leg, because the truth is it can extend the leg against gravity. So imagine trying to stand from a sitting or squatting position. When you're sitting or you're squatting, imagine trying to stand. Well, that is the function of the quadriceps femoris. And you know, it is a two-joint muscle, which means it crosses two joints, the hip joint and the knee joint. So it's going to work on the hip and of course on the knee joint. So we can say that it extends the leg at the knee joint and also steadies the hip joint. That's majorly the rectus femoris. Now, talking about the medial compartment of the thigh, well, I haven't forgotten there are other things we need to talk about in the medial anterior compartment, like the femoral triangle and the rest of them. But let's talk about the medial compartment of the thigh first. Okay, in the medial compartment of the thigh, looking at this from the medial aspect now, we have different muscles in the medial compartment of the thigh. One of those muscles is the adductor longus, adductor brevis, and the adductor magnus. Okay, so let's first of all deal with the let's deal with the adductor longus first. Okay, the adductor longus is as you can see, triangular in shape. Okay, if let's remove this muscle here, let's remove the Sartorius muscle. Okay, so that we'll be able to see the adductor longus properly. So the adductor longus is triangular. Okay, let me also remove this. Let me remove this so that we'll be able to view our muscle properly. Okay, so I think this is good. Okay, so let's leave this. Okay, so the adductor muscle, the adductor longus is triangular in shape, and it's long, and it's placed anteriorly. Even though it's a medial, yes, it's not really anteriorly, but when you compare it to other muscles of the medial compartment, it's placed anteriorly. And proximally, it attaches to the body of the pubis, as you can see up there, to the pubis, and distally, it goes to the middle third of the linear aspera. As you can see, it is the most lower of the adductor muscle. What I mean by that is It is the only one that does not serve two masters. It does not have any other function. I'll tell you their function. I'll tell you all their functions. But I want you to have in mind that the adductor longus is the only loyal muscle of the adductors because it does not serve any other function except one. Then talking about the adductor brevis here, the adductor brevis is short and deep when you compare it to the adductor longus, and proximally it is attached to the body and inferior ramus of the pubis, and distally it is attached to the pectineal line and proximal part of the linea aspera of the femur. Its function is that it actually adducts the thigh. It adducts the thigh and also flexes it. Okay, it flexes it. Okay, it adducts the thigh, and it's supposed to be an adductor muscle. So adductor muscles are supposed to only adduct the thigh. For example, the adductor longus is loyal to adduction. Okay, ADD. Okay, but the adductor brevis adducts the thigh and also flexes it, even though a little bit. Okay, so now we have another muscle called the adductor magnus. Now the adductor magnus, but first of all, let's talk about the gracilis muscle first before we talk about the adductor muscle, so that we'll be able to remove it, so you'll be able to view it properly. Okay, the gracilis muscle is long, almost looking like the Sartorius muscle. Okay, it's long, it is slender, and the most medial, okay, most medial and most superficial of the joint. But because it's the most medial and most superficial, actually it is the weakest of the adductor muscle. It attaches proximally to the body and inferior ramus of pubis and distally to the upper part of the medial surface of tibia via through what we call the pes anserenus. Okay, the pes anserenus is alongside with that means the gracilis attaches alongside with the Sartorius muscle of the anterior compartment and also the semitendinosus of the posterior compartment. Now, if you remember, it is a two-joint muscle. It crosses the two joints. Okay, so it's a two-joint muscle. Hence, it's supposed to perform other functions. So it adducts the thigh, it flexes the leg, and also assists in its medial rotation. So it adducts ADD the thigh. Okay, so it also has other function. You can now see that the adductor longus is actually the loyal one here. Then let's remove this muscle so that we'll be able to view the adductor magnus properly. Now the adductor magnus is triangular, as you can see, and actually it is the strongest and most posterior muscle of the adductor compartment. It has two parts. It has an adductor part which is proximally attached, which is proximally coming from the istiopubic ramus and distally to the gluteal tuberosity, linea aspera, and the medial supracondylar line. Why it has a hamstring part, which means that one of them, part of the adductor magnus, also does the function of the posterior compartment of the thigh. That's the hamstring. So it has a hamstring part which is proximally from the ischial tuberosity and then to the adductor tubercle distally. Now the adductor part does well. It actually flexes the thigh, okay, while the hamstring part extends the thigh. So the adductor part helps to adduct the thigh, it helps to flex the thigh, while the hamstring part helps to also extend the thigh, which means it does the same job as the adductor muscle. Okay, there's another muscle in the medial compartment that is not shown in this diagram. I would have loved to show it in this diagram. It's called the obturator externus. Okay, that one is small, flat, and located in the superior part of the medial thigh. It attaches to the margin of the obturator foramen. If you remember when we were talking about the pelvic bone, we spoke about the muscle attached to the obturator foramen. Now, a nerve supply to the adductor muscle is actually they are all supplied by the obturator nerve. Okay, they are all supplied by the obturator nerve. But if you remember, the obturator nerve enters the medial compartment of the thigh from the obturator canal. So as soon as it enters through the obturator canal, if you remember from our lumbosacral plexus, it divides into an anterior and a posterior part, which is anterior and posterior to the adductor brevis. So the reason why we say that the obturator muscle, obturator nerve divides into two, anterior and posterior, is because one of the artery, one of the nerve is anterior to the adductor brevis, while one is posterior to the adductor brevis. Now, let me try and rephrase what I just said. The adductor longus and brevis are supplied by the anterior division of the obturator nerve. So listen, the adductor longus and the adductor brevis, adductor longus and the adductor brevis is supplied. This adductor longus and adductor longus and the adductor brevis is supplied by the anterior division of the obturator nerve, while the adductor part of the adductor magnus is supplied by the posterior division of the obturator nerve. Then the hamstring part, of course, you expect it to be supplied by any nerve that supply the posterior compartment of the thigh, which is the tibial nerve. Now, the gracilis muscle and the obturator externus are all supplied purely by the obturator nerve before it divides into anterior and posterior division. Now, okay, look at this image. Aponeurotic and tendinous distal attachment of the adductor and the hamstring part of the adductor magnus, just lateral and superior to the adductor tubercle of the femur. As you can see, that is the adductor tubercle there. Okay, that's the adductor tubercle there. Okay, so it means that it is an opening that is available for the transport for the femoral artery and vein from the adductor canal, okay, from the adductor canal in the thigh to the popliteal fossa at the posterior part of the knee. So the adductor hiatus is only present for vessels to transmit from the anterior compartment to the posterior compartment. Now, you might say, I just mentioned something now. That is the adductor canal. What is the adductor canal and where is it located? Okay, let me show you another image that will best represent that. Okay. Okay, that is the adductor canal. As you can see, the arrow showing that right there. It is a long, narrow aponeurotic tunnel in the middle third of the thigh from the apex of the femoral triangle right here. From the apex of the femoral triangle, this is the femoral triangle here. We'll still discuss that in a jiffy. From its apex of the femoral triangle to the adductor hiatus inferiorly there in the tendon of the adductor magnus. What this does is it provides an intermuscular passage for the femoral artery and vein, the saphenous nerve, and the nerve to the vastus medialis. It also leads the femoral vessel to the popliteal fossa, where they become the popliteal vessel. You know, from the adductor, so structures, vessels move from the adductor canal to the adductor hiatus, from the adductor hiatus to be transmitted to the popliteal fossa. Now, the adductor canal, of course, has boundaries because it is, since it is, it's an aponeurotic tunnel, okay, in the middle third of the thigh. Okay, in the middle third of the thigh. So you expect it to be surrounded by muscles. And one of those muscles it's surrounded by, so the anterior compartment, the anterior and lateral boundary is formed by the vastus medialis. So the anterior and the the lateral boundary is formed by the vastus medialis. The posterior boundary is formed by the adductor longus and the adductor magnus, while medially it is bounded by the Sartorius muscle. Although the Sartorius muscle also, as you can see, forms the roof of the canal. Then the apex is formed by the adductor hiatus, the one we mentioned the other time. Now, in the inferior third to half of the canal, the vasto-adductor fascia between the adductor longus and vastus medialis forms the anterior wall of the canal deep to the Sartorius. Of course, we can also say that, in order not to get the whole thing complicated, we can say that the Sartorius also forms the roof of the canal. Now, about the posterior. We are going to talk about the posterior compartment of the thigh, and in the posterior compartment of the thigh we have different muscles. Okay, we have different muscles in the posterior compartment of the thigh. We have the biceps femoris muscle, we have the semitendinosus muscle, and of course we have the semimembranosus muscle. So let's start with the semitendinosus. The semitendinosus muscle attaches proximally to the ischial tuberosity and distally to the medial surface of the superior part of the tibia. Remember the pes acerinus. The pes acerinus, it's also the semitendinosus also forms part of the pes acerinus. Okay, so now the semimembranosus is this muscle here is a large muscle. It's also attached proximally to the ischial tuberosity, but distally its tendon divides to the posterior part of the medial condyle. So if you come across the oblique popliteal ligament, it is the reflected attachment of the semimembranosus that forms the oblique popliteal ligament. Now, what is the function of this muscle? They extend the thigh, okay, flex the leg, and of course rotate it medially when the knee is flexed. Okay, now talking about the biceps femoris right now, the biceps femoris originate from the long head. Okay, the long head is from the ischial tuberosity. Why it has two heads? That's what I mean. Bicep, from the word biceps. Long head is from the ischial tuberosity. Short head is from the short head is from the whole length of the linea aspera and upper part of the lateral supracondylar line of the femur. But the insertion is actually to the head of the fibula. That's the biceps femoris. The two heads comes together, then they insert to the head of the fibula. Now, what are the blood supply? The function, the nerve supply of the hamstring is actually from the tibial component of the sciatic nerve. Okay, it supplies the ischial part of the adductor magnus and all three muscles of the hamstring, while the common peroneal nerve is the one that supplies the short head of the bicep muscle. And what is the function of this hamstring muscle? Well, they help in flexion of the knee and also extension of the hip. Now, the biceps femoris is a lateral rotator. Okay, and the semitendinosus and the membranosus are medial rotators when the knees are semi-flexed. Now, there's something important at the back of the thigh, okay, known as the popliteal fossa. Okay, the popliteal fossa is located just at the back of the knee here. Okay, so if you remember the cubital fossa in the upper limb, well, the popliteal fossa is like the elder brother. Well, it is a diamond-shaped spot at the posterior aspect of the knee. It serves as the main gateway by which structures like arteries, veins, and nerve transfer from the thigh to the leg, or the other way around. If you remember the adductor hiatus that transmit structures from the anterior compartment to the popliteal fossa, well, this is the popliteal fossa that we are talking about. Of course, it has, just like any other space, it has borders that are formed by muscles from the posterior thigh and also from the the leg. Now, superior-medial border, the superior-medial border is formed by the biceps femoris. Okay, the superior-medial border is formed by the biceps femoris. Okay, while the superior-lateral border is formed by the superior-medial border is formed by the semimembranosus, while the superior-lateral border is formed by the biceps femoris. Now, the inferior-medial border is actually formed by the medial head. If you notice, this muscle in green is called the gastrocnemius. The gastrocnemius muscle has two heads. It has a medial head and it has a lateral head. So the inferior-medial border of the popliteal fossa is formed by the medial head of the gastrocnemius, while the inferior-lateral border is formed by the lateral head of the gastrocnemius, and also a muscle called the plantaris muscle. Now, the floor of the that's the muscle called the plantaris muscle, the one in green right now. So we can say that both the lateral head and the plantaris form the inferior-lateral border of the popliteal fossa. Now, the floor of the popliteal fossa is formed by the posterior surface of the knee joint capsule and the posterior surface of the femur, while the roof is actually formed by, actually has two layers. It has a popliteal fascia, which is continuous with the fascial lateral of the leg and also the skin. So we say that the popliteal fascia and the skin forms the roof of the popliteal fossa. Now, what are the contents of this fossa? It doesn't have a blood supply, but it has content. Okay, it contains the popliteal artery, which is actually the deepest content of the popliteal fossa. It contains the popliteal vein, and it also has branches of the sciatic nerve. That's the tibial and the common fibular nerve. The common fibular nerve is actually the most superficial. It also has an important vein called the saphenous vein, which pierces the roof of the fascia into the fossa to drain into the popliteal vein. What are in all that we talked about, what are the applied anatomy? For example, the applied anatomy of the popliteal fossa. There's something called the Baker's cyst. Okay, the Baker's cyst is an inflammation and swelling of the semimembranosus bursa of the knee joint. There's a bursa at the semimembranosus, okay, called the semimembranosus bursa. So when there's an inflammation of the semimembranosus bursa of the knee joint, that is called the Baker's cyst. Of course, I'll be sending in pictures of this inflammation to the group later on. There's something called the popliteal aneurysm or hemorrhage. Okay, now dilation of the popliteal artery sometimes can be more, about 50% of the original diameter of this artery, but the roof of the fossa is a very tough man. The roof of the fossa is a tough man, so the dilation, it cannot allow the popliteal artery to dilate, okay, towards it. So, so in the case of dilation, the content of the fossa will be affected because it cannot move up, since the roof of the popliteal fossa is actually a very tough man. Okay, so this will actually affect other content of the fossa. Just like if you remember in the upper limb, when we have the carpal tunnel syndrome, whenever there's problem with one of these nerves, other structures there will be affected. There's also something called the popliteal abscess or tumor. Now, because the deep popliteal fascia is strong, and remember I said, and it limits expansion of the popliteal artery, for example. Okay, whenever there's pain from abscess or tumor in the popliteal fossa, it is very, very severe because it cannot move anywhere since the fascia is actually strong. So the popliteal abscess tend to, move or spread superiorly and inferiorly because of the toughness of the popliteal fascia. And the popliteal fascia and the skin, okay, also forms the roof. Then there's also something called the popliteal pulse. Remember the popliteal artery, it's actually very deep. It makes it difficult to feel this pulse. But there's a way around it, actually. There's a way one can feel the popliteal pulse, actually. The pulsations are best felt in the inferior part of the fossa, okay? Just in the inferior part of the fossa, okay, where the popliteal artery is related to the tibia. But for this to happen, the person has to be in a prone position. Okay, the person has to be in a prone position with the knee flexed to relax, so that the popliteal fascia and hamstrings can be relaxed. That's the only way the popliteal force can be felt. And then, why are we passing through a lot of stress to feel this pulse? Actually, weakening or loss of the popliteal pulse is a sign of a femoral obstruction. Also, we can also have an injury to the tibial nerve, although injury to the tibial nerve in the popliteal fossa does not happen often. However, when it does, probably due to laceration or if there's a posterior dislocation of the knee joint, it causes inability to plantar flex the ankle or flex the toe, and there's loss of sensation to the sole of the foot.